Hi, I'm Dr. Donald Pelto, and I want to talk to you a little bit about a topic that's interesting and new and maybe helpful to many people that are watching. The topic is called presentation. To do an introduction, I'm going to first show you an example of one of these patient presentations that I do for my patients in the clinic. Before we start, I just want to explain how it all started. I started having the idea of patient presentations in 2005 where I considered doing a patient presentation, but I asked another physician and he said, "Oh, we don't have time. We don't have computers in the office. It's not going to work." Then in 2012, I started doing a pre surgical discussion, which worked pretty well. And I'll kind of explain a little bit why that all happened. And then 2013, I started my plantar fasciitis one, which I'm going to show you shortly. And then I've been doing those periodically since 2013, but more recently, I found the greatest results lately with increased results with my patients, continuity, referrals, reputation, and mostly it just makes my job a lot more fun. So here's the presentation that I give to my patients about plantar fasciitis when they come in the office. And this will include all the different aspects, and then we'll go a little bit deeper into the presentation itself. So plantar fasciitis is actually a problem that happens on the bottom of the heel, right here, where there's inflammation of the fascia. Now, the fascia is a little ligament that goes from the heel to the ball of the foot. And it's intimately attached with the Achilles tendon, which attaches also on the heel and it pulls. So you can see if your Achilles is tight, your plantar fascia is going to be tight. And if your fascia is tight, your Achilles is going to be tight. And a lot of the focus is going to be on loosening up the calf muscle here and reducing this inflammation here on the area of the fascia. And I find it's a lot easier to show you these pictures than just kind of explaining it verbally because you're able to have an audio visual presentation. Now, the muscles that are in the back of the leg, specifically the posterior tibial muscle, this one actually goes down and it inserts right around the area of the plantar fascia. So if these muscles in the back of the calf are tight, many times that can contribute to this pain in the plantar fascia. So it's not always from the fascia itself, and many times it's caused by these muscles because the fascia is not a primary support structure. The primary support structure are the bones in your foot and the muscles. So those are to support the foot. And at this time, I would flash away and show an example of one of their x-rays. But here's an example of an x-ray that has a heel spur. Sometimes a heel spur can contribute to the problem, but it usually isn't the problem. Very rarely nowadays do we remove the heel spur. But a bigger problem can be seen here on a diagnostic ultrasound. You can see a normal fascial thickness and a thickened fascia. This is, if you flip this upside down, you can see this is the heel region here, and this is the fascia above it. So an ultrasound, which we'll probably plan on doing at the next visit in a couple of weeks, is going to show the actual thickness of the fascia. But what can you do now? So to reduce the inflammation, I recommend icing. You can take a bottle of water, put it in the freezer, and roll it on the bottom of your foot. You can also do something called a contrast bath, which is where you put your foot in hot water and then cold water, and cold water. You can take some anti-inflammatories, and I'll prescribe those to you. I usually like naproxen because it's twice a day dosing, so you don't forget the third dose of something else like Motrin or ibuprofen. We'll do a cortisone injection into the heel today. This is going to reduce the inflammation for you. Sometimes I do it with ultrasound guidance. If needed, we can do that as well. Another treatment that I do is something called shockwave. So for those that are athletic and that do not want a cortisone, or they don't want the risks, because every cortisone does have a risk of kind of weakening the area down there, we do shockwave therapy. So shockwave therapy uses sound waves to break up the thickness and increase the blood flow to the area that's injured. This is a very good treatment. We do these treatments, they take about 10 or 15 minutes. We do them 2 weeks apart, and we do them for 3 sessions, and they work very well. Usually they're not covered by your insurance, but we try to keep the price at a reasonable amount. The second aspect, we want to reduce the tightness in the back of the calf. This is going to be the focus of your work at home. So we use 3 tools. One's the trigger point tools right here with this yoga block and a ball, and there's other tools that go with it. Some people use a foam roller, and some people use this stick. But whatever you want to use, whatever's easiest for you, we're going to show you how to use those, and that's going to be your home exercises. I like you to do that twice a day. And then physical therapy. I always find that patients that go to physical therapy, they get better faster. And one of the techniques that they do at physical therapy is called the Graston technique. So I'm going to have you have some Graston technique. Stretching, I think, is helpful. Most people try stretching before they come and see me in the office, so I'm not going to recommend too much stretching. You can do some on your own if you'd like. Dynasplint or a night splint, these can be helpful. These are most helpful if you have pain when you get up in the morning. If you have that first step pain, I find a night splint can be helpful. If you've tried many other things and nothing's really worked, then I think a Dynasplint can be helpful. The next one we have to look at is what type of shoes you're wearing. I like a nice supportive shoe that's going to help stabilize your heel. Okay, I like Asics, New Balance, Saucony, some type of a stable shoe. Now, I always say that a nice stable shoe is for now. It's not forever. And you can go back to wearing your other types of shoes, but I find a lot of people, they have plantar fasciitis because they're doing a lot of activity with unsupportive shoes or wearing these flip-flops, doing too much activity, something that kind of aggravates it. So you have to figure out, was it a shoe gear or an activity that aggravated your plantar fasciitis? And then also orthotics for people when we watch you walk. If your heels kind of go outward, that puts a lot more strain on the posterior tibial tendon that we talked about, and also on the plantar fascia. So the whole goal of an orthotic is something that goes in your shoe, but the whole goal is that it stabilizes your heel. You see how this line is crooked, and here it's straight, and that's the whole goal of the orthotic, is to stabilize your heel position. Okay, I'm going to give you some resources here. This is called a Postwire page. It's an individual web page where I'm going to put your name up top. I'm going to give you some information about your condition, and on the bottom, there's a place where you can post a comment. There's also some things you can share your experience. So let me show you what that looks like. If we open up this screen here, we can see a page that's made for someone. What I would do is I would put your name up top, and I would show you what it looked like here in this preview page. So in the preview page, you can see here some helpful information about plantar fasciitis. If you want to, you can share it with someone simply by clicking this, and it'll put, you can put their email in there and it'll share it, okay, with someone else. What I put in here is an actual video of what we just talked about. If you click this, it's going to start a video that links to YouTube about this condition. Here you're going to find another type of a PowerPoint presentation like I'm doing now. Here are the actual slides if you want to review them. Here is a written version of what we talked about. Some people like to read things. Now, we talked a little bit about the foam rolling. So every time you see a number 3 up top or a number, you can expand it. There's other videos. So here's some foam rolling exercises, some trigger point tools, and some calf stretches. Those are all videos that you can watch. Here's some information about cortisone injections, contrast baths, and here's some of the advanced treatments such as EPAT, Shockwave, TenJet, and some of the other advanced treatments. So you can look at all of that. And also, as we finish giving this to you, if you found your visit helpful, I'd like you to write a review, because many patients come from the internet these days. And what you do with this is you hit the expand button, and there's different places where they can write a review, such as Google, Yelp, LinkedIn, Facebook, WebMD. What I'd like you to do, if you would just do that for me, is to click on one of these and go write a little review on the presentation. Okay, so let's go back here and go to the next slide here. So this is basically a review of the different types of treatments that we went over. So we started out with an X-ray today. When I see you back in a couple weeks, we'll do a diagnostic ultrasound to evaluate the thickness. MRI might be needed for you as well. And then some of the traditional treatments would be to reduce the inflammation, such as icing, anti-inflammatory, and contrast baths. We'll do a cortisone today, and then I don't like to do them 8 weeks, until 8 weeks, just to not weaken the fascia. So during that period, let's say when I see you in a couple weeks and we'll do the ultrasound, if you're still having pain, we could either do a walking boot or we can do the shockwave therapy to kind of reduce the pain and inflammation down there by increasing the blood flow. Reducing the tightness can be helpful as well with the foam roller, the physical therapy, and then the night splint if you're having pain in the morning. And then finally, the supportive shoes, custom orthotics, and then the sometimes people use compression sleeves, and then here's some of the advanced treatments. So I don't know if we're not gonna have to go there. Okay. So basically, that was the plantar fasciitis presentation that you saw. And the reason it started, it was because of just the difficulty of certain conditions like plantar fasciitis and other conditions that are very complex to explain. And I started with a pre-surgical discussion initially, and it really went well with pre-surgical discussion. And I was doing that, and I figured, well, I really enjoy doing those pre-surgical discussions to go over the details. Now I want to expand it to another area. And so I expanded it to plantar fasciitis and Achilles tendonitis, warts. And I started to use these more and more in the office, and I recorded them later on into an actual video presentation, which I offered to the patient that I showed you. And another thing about using Postwire is I can secure these and I can make them HIPAA secure. So patients can send me HIPAA secure information because they have to log in to look at their pages. So I expanded what's working. And the great thing about these presentations is it creates a wow experience for each patient. When you go to the room, you basically know when you see the patient what they have wrong with them. But for them, it's the first time, and they want to know that you understand and that you have a plan for them. And when you go in and you have these presentations, you're always prepared. You can present it on a computer, on an iPod. You can even do it on a cell phone if you need to, even though the screen's a little bit small. Like I mentioned before, you can actually take your own presentations and record them very easily, as I'm recording this, into a video. And you can give it to the patients even prior to their visit if they want to learn more. And you can send it out afterwards as a review like I do in my Postwire page. You can also put the video on the patient on your website so they can get more information. You can send the video out into social media. So those are different ways you can wow the patients, and they'll say, well, no one's ever been so prepared for what I'm treating. And basically you do the preparation on the top 20 or 30 things that you treat, and you have these little presentations made. So the benefits to me as a physician, it really, in my opinion, it reduces my liability, especially with my surgical patients. I have a nice pre-surgical discussion that I go over all the possible risks, complications, and I have it all documented, and people can refer to these videos or these presentations in the future if there's any questions. For the presentations, I'm always getting better. So every time a patient asks me a question that's not included in the presentation, I can modify the slides and I can add that in. It also helps me to slow myself down, because when you're with a patient, many times we're 2 or 3 stacked up, we're running a half hour behind. And when I have the outline of a presentation, I'm slowing myself down, I have a plan, and I can focus on giving that patient everything that they need for that visit. And I feel like I'm more complete. I don't really skip anything. Many times when we're in a rush, we're not going to offer everything to the patient that could be beneficial to them. But by this way of doing it this way, I can be more complete. I can also think I see additional patients, because since it is so efficient and quick, I think I can actually see more patients doing this because I'm all prepared. And I also can be more comprehensive to include additional treatments, because nowadays there are many other treatments that we offer that many times insurance doesn't cover, such as diagnostic ultrasound or like durable medical equipment like walking boots. And in my experience, I found by even just showing them a picture of an ultrasound and saying, okay, we're going to do it next time, kind of leading them, there's a lot less resistance to doing an ultrasound. For durable medical equipment, we call like walking boots, night splints, other types of braces. I find when I explain it and show them a picture and explain how it's used in the process, there's a lot less resistance. And I'm not really having to make them do things, and they want to do them. I show them that checklist at the end, and they've said, well, we've done all this. What haven't you done? Well, I haven't done a walking boot. So I'm doing a lot more walking boots because of that. And then finally, you can include different referral partners if you want. If you typically refer out to someone else, you can include them in that presentation to introduce them to the other person that you're going to refer them to. So the benefits, finally, to me personally, it's giving me more excitement in being a doctor. It reduces my overwhelm, because some of these conditions like Achilles tendonitis or plantar fasciitis, they have a lot of different treatment options. And just to explain them verbally gets a little overwhelming, and the patients don't remember either. So using the combination of the patient presentation with the Postwire page where I send it to them, they can review things. So it's easy to do. It makes it more fun. And I'm always getting better at these presentations. So every day I'm doing it, I'm tweaking it, making it better. And it's using technology ultimately to improve the patient care. And it saves me so much time because I can share these with them and communicate with them better. I've also found that it increases the referrals, okay? Because I can share this content with other people, and they can share it with their friends and other things like that. And I can also make this ask for online recommendations, which nowadays is so important. I can make it so much easier by doing that. So I want to go over a little bit about the patient presentations, the 3 phases of how to use patient presentations: before, during, and after. So before the visit, the patient makes an appointment to the office for a condition like plantar fasciitis. Once the appointment is scheduled, they're offered to go to the website prior. So this is my website. These are all the presentations that I have, and I'm underlining here the one for plantar fasciitis. And if they would click that, they would get those resources to review before they came in. And some people think, well, you're giving away too much information, but they're going to find it anyway online. They're going to be finding something, but I want to make sure they get the right information so they can review those resources before. During my visit, what happens is I use something called a Google Chrome. And if you see this little button called presentations, and so that's a bookmark I made, and these are all the presentations. You can see I have one on Achilles tendonitis, balance, bunion, diet and weight loss, fracture, heel fissures, ingrown toenails, down to plantar fasciitis. When I have this one saved and I put them all in alphabetical order, here's where it connects to Google Docs or Google Slides. Okay, and I can come in, basically click this, pull up the presentation, and I'm ready. So I pull up the x-rays first, and I pull up this, and I go kind of refer back and forth to that. So this is an example that what I did for you on plantar fasciitis. I just want to review this quickly, what the idea of the slides are. The first slide is always the title. Then I go through a lot of the history of kind of what caused the problem. I go through some of the diagnostic exams, and as I mentioned before, you can show them any exam. Like this is the x-ray, which I already do, but the ultrasound, sometimes it's not covered. And if I show this to them, a lot of times they're interested in doing that. And I think it's truly beneficial to the patient. You can add other things there. And this just goes over the treatment process. I think pictures really help when you're explaining the treatment process because they don't know what to expect. Pictures can help. Pictures of an ultrasound, of an injection, pictures of the EPAT or shockwave. So this would be the second visit, and they're already kind of prepared for that. Once again, this is something that isn't covered by insurance, but it's something that patients a lot of times get better with this type of a treatment. Talking about the tightness, once again, these treatments right here, they can go purchase them online or they can get them in the office. But for convenience, there's different options. If people are a little bit older, they have a hard time with the foam roller and the ball, they can use the stick or they can use one of these other two. This just explains my referral partners, like at different physical therapy places, and I prepare them for what type of treatment they're going to do there. Some stretching. Once again, DME item, which would be both a Dynasplint or a Night Splint, durable medical equipment. Once again, shoes, and then when I do the shoes, I'll also give them a shoe referral in my notes. So to a certain place that I refer for shoes with a shoe recommendation. And then orthotics as well. If they really have a pronated foot, then I will encourage them to do an orthotic. And this is the personal webpage. I actually have this slide, and I explain them. I'm going to put your name on here. You can ask any questions down here, and then when I click it, it's going to actually go over to that slide that I showed them. And then what I really like is this review. So this is a review to kind of say, okay, this is what we've done today. This is what are the options for you for the future. So whenever someone comes back, I'll show them just this slide. I won't redo the presentation, but I'll say, okay, what have we done? Okay, we've done x-ray, we've done ultrasound, we've done icing, we've done all these things, a cortisone. Okay, we have an 8-week interval. So let's do shockwave next, or let's do the walking boot, or let's do a custom orthotic. We haven't tried those things, or it's really not getting better. We'll do an MRI. And then if they've tried all these, then we can go to the advanced treatments. These are more expensive. There are some surgical techniques like either surgery or amniotic tissue allograft or hydrocision. So it works really just to kind of have everything in there. So during the visit, also I put some documentation in the chart. So you can say here, today reviewed with patient a presentation about their condition that discussed the diagnosis, cause of the problem, and treatment options. This presentation includes pictures, examples, to better explain their health condition, and a copy of the presentation was provided electronically to review at their home. So this is about the patient presentation. And then Postwire is the online resource. So a Postwire online resource page was recommended for the patient. They'll need to log in and access the resources that were shared with them. The resources that were added to the page are intended to be a reminder of information discussed while at the office. In this instance, we shared information on our treatment plan for their condition. If the patient has any questions, they should reach out via the patient portal. So this is what I do during the visit. And then after the visit, I get usually the online reviews because I ask everyone for them. And that's really helping to drive more patients into the office. It's HIPAA secure, so that's great for reducing liability. And then I can also track, because I can log into that page, that Postwire page, and I can see that Paul here, he put 2 comments, and he looked at that page 9 times. And the last time was 5 days ago. And Gretchen here, she didn't make any comments, but she at least looked at it. So you can see if people are looking at what you're sending them or if they're not looking. And so it's a good tracker to even see how compliant they are if the messages come through. And so the follow-up visit, like I said, I review these next treatments when they come in. So you can also, going a little bit beyond and how else you can use the patient presentation. So once you have them, you can use them for videos. You can actually take the presentation into a screencast or a video to make it. So here's an example of one video. I took those slides that I went over previously, and I made a little video, and I put that on YouTube on how to treat plantar fasciitis. Another thing that you can do is you can use it for social media. So you can take either the big video or you can cut the video up in pieces and you can send out little segments to social media. So here's one that we send out to our patients. It says, if you are scheduled to plan or schedule a foot surgery, this newsletter, Dr. Pelto talks about different aspects of bunion surgery. He reviews the most important questions to ask. So this is what I put. What do you need to know about before bunion surgery? So they can watch this. This is sent through our patient portal to the patients in the office. You can also, if you're really advanced, you can use the patient presentation recording that you do for your blog or for keywords. This is really kind of an advanced thing, but let me show you here. So in my blog, I put how to treat plantar fasciitis. I put my video down there. But what I also copy is I go onto YouTube and I take the transcript, and you can take and copy and paste that transcript right in there underneath this, and that's going to have good keyword search. So that's something I can show you later if you're interested. But you go to YouTube, you open it up, and you can get the keyword search. And so basically, if you're interested in patient presentations and you want to learn more, you can email me, okay? And I can give you some more information. If you want a free post-wire page with all this information, just I'll give you all the stuff that I just went over. I'll give you tools how to get started. Send me an email, and I'll send you the post-wire page with all this just for you. You can feel free to share it with others, and if you have any questions or how I can make this better, this is one of the beginning presentations I'm doing on this topic, but I think it's of interest to all those that are in healthcare, all those that are kind of working with other doctors or with other nurses or other people. I think this would help different professions as well, different lawyers, different insurance salesmen, different other people, whatever you want to do and you're doing a presentation, it would help you. So if you want this information sent to you, just send me an email. Say, please send me the patient presentation that you did. donpelto@gmail.com. Happy to reach out to you. Okay, thank you so much.